The very nature of what we do in advanced care at home positions us so well to identify barriers to healthy living or access to care. So in our programs, we are quite literally living lives with our patients.
I think the receptivity of patients and the receptivity of providers, right? Out of necessity, but then out of necessity, seeing the utility of it has really been quite phenomenal.
You know, it seems crazy to a lot of programs that we're taking care of patients who've undergone a bone marrow transplant or a kidney transplant, and even from the operating room to home. So that seemed really implausible just a few years ago.
Hello and welcome to the Permanente Medicine Podcast. I'm Chris Grant, your host and Chief Operating Officer of the Permanente Federation. We have another exciting episode for you as we look at the future of care and the promise of advanced care at home programs, sometimes known as hospital at home. We'll discuss such programs' impact on quality of care and outcomes for patients. Our guests today bring a wealth of knowledge on this topic, and I can't wait to hear their thoughts. Joining me is Dr. Vivian Reyes, Regional Medical Director of Strategic Hospital Initiatives for the Permanente Medical Group in Northern California. Dr. Reyes also serves as the National Physician Leader for Kaiser Permanente Care at Home program, which brings acute-level care services to the patient's home. Also joining me is Dr. Margaret Paulson, Medical Director for Advanced Care at Home and Home Health for Mayo Clinic Health System in Northwest Wisconsin, and we'll hear more about Mayo's partnership with Kaiser Permanente in this area later. Dr. Paulson is a rural hospitalist and is an assistant professor of medicine at the Mayo Clinic School of Medicine. Thank you both for joining the show today. I'm really looking forward to learning more from you about the evolution of advanced care at home.
Thanks for having us.
Yeah, Chris, thank you so much for having us. And I am really excited to talk about advanced care at home because I think it is a healthcare model that people are less familiar with. So thank you again.
And I too am super excited. So why don't we get started here? Some of our listeners might not be familiar with what we're calling advanced care at home. I'd love it if you would each share a little bit more about what this type of care looks like and your work in this space. Vivian, let's get started with you.
Absolutely. So advanced care at home is really a healthcare delivery model that allows patients to receive advanced care in their homes. So I see this as a modern evolution of healthcare. And if you think back to the 1700s, where doctors were actually treating patients in their homes. So what would happen is patients would go to their doctor's office, and when they got sick, the doctor would then take his or her care, into the home. And so what happened at that point was really the family and the community were providing the support to the patient so that they can get through their illness under the direction of the physician. Now, fast forward, and over time, patients became more medically complex and medicine became more complex. And the need for healthcare teams, especially nursing, really came to be essential to provide advanced care to patients. And so then what you started seeing is hospitals, and this was the industrialization of healthcare. And so patients who required advanced care for their acute illnesses would be centralized into a hospital so that you can have physicians treat all the patients all in one place, and all of the services are centralized. But now, with the advances in technology, we are actually able to go back to providing this advanced care in a patient's home. And so what does this look like to a patient today? Well, if you're sick, you go to the emergency department, and a physician might decide, I think you need ongoing care and you need an advanced level of care, meaning it's not something that your primary care doctor would be able to give you. And so at that point, if you were eligible for the program, you would be given the option to either receive that advanced care in the brick and mortar hospital or into a program such as advanced care at home. And so if you were to opt in, what would happen is you would be transported to your home where you would be met by a team that sets up a suite of technology, brings you supplies and equipment, and sets this up in your home so that you can receive your care there. You would be connected to your virtual care team, which is comprised of a physician, a nurse, a care coordinator, and a pharmacist, and they would be evaluating you and leading and driving your care. And in conjunction with that team, you would then be met with service providers that come into your home and examine you, such as a physician assistant. If the care team deemed necessary, if you need daily labs or imaging, physical therapy, maybe IV infusions, all of that can be brought to you as appropriate in your home. And so all of this advanced care is provided to our patients in their home in, the comfort of their own bed where they can sleep, and they have their family and their pets there, and they're able to recover from their illness in a much more healing environment.
Wow, that's fantastic. And you provided such a really nice visualization. It's a little Back to the Future, right? Where we remember the old days of house calls, and then it became impossible with all the technological advances. But now technology is at a place where actually people can get well, where they feel the most comfortable with some of the most advanced technology and people surrounding them. Dr. Paulson, I'd love your vision for this, and what does it mean for the future?
Yeah, and I really appreciate that overview by Vivian, because I think our programs are structured very similarly. But the Mayo Clinic story began back in 2019 when our CEO, Dr. Gianrico Ferrugia, was just thinking about the 2030 vision for Mayo Clinic and how we're going to meet patients' needs. And one concept that kept bubbling up that was truly paradigm shifting was hospital at home. So how could we really move the needle on how we care for hospitalized patients and do so in probably even a more humane way than institutionalizing them? So this concept came up, and this all started before the COVID-19 pandemic, but we had a really nimble team. So two sites were chosen, two initial sites. One, the Destination Medical Center campus in Jacksonville, Florida. So they do a lot of complex care for patients, transplant care. They're known for their oncology services. So they house the command center that oversees the virtual care of these patients. So they launched in July of 2020. And a month later, where I'm from, in Eau Claire, Wisconsin, where our hospital is, it's a community hospital that's really surrounded by a rural landscape. So it's kind of this beautiful experiment of, how can you pair together these two very different settings, but serve patients through the same hospital at home concept. Our leader across all of our sites, Dr. Mike Maniaggi, I'd be remiss if I didn't mention him. He has really expanded the hospital at home program, advanced care at home for Mayo Clinic, now to the Arizona campus and Minnesota. So it's pretty incredible how you can share resources, including people and services, and extend this care. And in doing so, we're really offering this high quality of care, and we can focus then on meeting the patient's unique needs. We're in their homes, we're at their bedsides, we're getting this glimpse into their lives that, as a hospitalist in a traditional hospital, I wouldn't ordinarily receive. So it's been a powerful and beautiful way of offering acute care.
You're right. It allows us to treat the whole person, because now we actually can see what surrounds them, the family, the support, or sometimes the lack of that. We should disclose to our listeners that Kaiser Permanente and Mayo Clinic jointly invested in a Boston-based medical technology company, Medically Home, which provides a platform making hospital-level care at home possible. The organizations also co-founded the Advanced Care at Home Coalition in 2021 to support advancement of these programs with policymakers and throughout the industry. I'd love if you could share a little bit about the mission of the Advanced Care at Home Coalition and some of its current advocacy efforts. Margaret, why don't we start with you on this one?
Yeah, so I think What hospital at home programs recognized right off the bat is that we need a policy landscape and a regulatory structure that really supports this type of care. One barrier that many programs have gone up against is, this uncertainty in reimbursement. So that has really, beyond the public health emergency, what was going to happen? Will we continue to receive funds for providing this care? And that prevented a lot of hospitals from even launching programs, or, if they had them, from expanding. So the Advanced Care at Home Coalition kind of brings together people who can work on advocacy efforts to extend these flexibilities to care for, patients, things that we enjoyed during the COVID pandemic. Just announced the public health emergency is coming to an end. So we're excited that we had this 2-year extension with the omnibus bill at the end of 2022. But, beyond that, what will happen? So team members in the coalition can come together, share learning, share best practices, and even barriers with state laws so that we can continue to advance policy and regulatory structure. And ultimately, that helps us advocate for our patients to provide this care.
Outstanding. Vivian, additional thoughts?
Yeah, I agree with Margaret. I think that this coalition has done tremendous work. And to add on to her point of, the omnibus bill extending our ability to run these advanced care at home programs past the public health emergency, what the hope is that if we can create a Centers for Medicare and Medicaid Services Innovation Center, that we can then model this program and test it. I think that's really the ultimate goal is, these are new programs and we do not have a quality framework just yet set. And so this coalition has really been working to advocate for that. And they've created a framework to really describe components that assess the quality of these programs. And so I think it's really important, to Margaret's point earlier, we are trying to provide higher quality of care and safe programs. And so through this coalition, we are really working to advocate for that at a national and federal level.
I'm really excited about the work of the coalition that you described, because this is new technology and policymakers don't necessarily understand it. So having a group of experts such as both of you be there to both establish a standard for the care that really ensures the highest quality and safety, but also helps educate them on how policies need to evolve in order to support the advancement of technology. Vivian, you've been on the circuit, as they say in the business, talking about Kaiser Permanente's Care at Home program. And in those conversations, I've heard you highlight the importance of making this program accessible to underserved areas, such a critical need. Can you speak to these efforts and the need to bridge disparities in healthcare?
Yes, health equity is a huge focus for us at Kaiser Permanente, and we've done a lot of work to assure that our program is available to patients in underserved areas. The very nature of what we do in advanced care at home positions us so well to identify barriers to healthy living or access to care. So in our programs, we are quite literally living lives with our patients. We are in their homes. We see their relationships. We see, their everyday challenges. And so for some examples, we see transportation challenges is a big reason that patients can't make their appointments or can't go to a pharmacy to pick up their medications. And that's why they have come to, decline from a health perspective. So having that view into their home and being able to identify these barriers allows us then to address them in a more holistic fashion, which is something we've not been able to do in the traditional hospital setting.
Margaret, I'd love to hear your insight here.
Yeah, Chris, I'm so glad you asked this question. And I just want to thank Vivian, because I know she's a tireless supporter for the underserved, and certainly that's part of Kaiser's mission. So we learn from you guys all the time. With Hospital at Home, I think it's fortunate that so many programs are launching at a time in the U.S. where we're having this reckoning with diversity, equity, and inclusion. And I think that makes it possible, as programs are launching, to kind of weave DEI efforts, including access to care, into every aspect of hospital at home programming. One example, we screen our patients to ensure that their home environment is safe for both them and our staff going into the home. It's a necessary part of the process, but even just that screening may automatically reinforce disparities that exist with access to care. And we need to be able to acknowledge that there are problems of housing and caregiving and health insurance, and to address them, we need to partner with organizations and community resources outside of Mayo Clinic and outside of Kaiser Permanente to be able to create more access to care. And one issue that's close to my heart is rural. So issues of rurality come up quite a bit. So I live in this small community with a small Mayo Clinic hospital, 25 beds, and under current CMS rules, this hospital isn't allowed to have a hospital at home program. So we know that rural areas are disproportionately affected by access to care. So how can we work together to, take that barrier away again? We know this care is safe and effective, and patients want it. So paying attention to DEI and access to care will be really important as we move ahead.
Both of your explanations are really quite moving, because all of us are focused on addressing disparities in health and engaging patients where they stand, where they live, really allows us to understand their social setting. Margaret, your team has been active in publishing the Mayo Clinic experience with hospital at home. What were some of the key learnings that come from this work, and how are you applying them to your current work with the Advanced Care at Home program?
Yeah, so there's already amazing data on hospital at home. While it's only recently launched or taken off in the US, it's been around for decades in other parts of the world. There's just a lot of data already out there. We know that it's safe, we know it's effective, and that patient satisfaction is high. But every setting is a little different, and those studies tend to be small. A lot of programs haven't yet scaled. So it's been exciting. Mayo Clinic is publishing on our experiences with our unique patient populations. And one thing Mayo Clinic is known for is for caring for very complex patients. So, it seems crazy to a lot of programs that, we're taking care of patients who've undergone a bone marrow transplant or a kidney transplant, and even, from the operating room to home. So that seemed really implausible just a few years ago. So as our program evolves, and we wanted to share those learnings with others. We were talking about the social determinants of health earlier. We teamed up with some social scientists to really dig into that. What's our current state? How can we leverage community resources so we can continue to adapt and make hospital at home accessible for more patients? But it's definitely a team effort.
And I can see how moving care to where people live also deepens the relationship between institutions, whether it's Mayo or Kaiser Permanente or Cleveland Clinic or whomever, with many of the local services that reside within a community. We talked earlier about the COVID-19 pandemic and how it's dramatically accelerated innovation and the needs in advanced care space. I'd like to hear you both talk a bit about what it's been like to be at the center of this transformation and how it's changed the day-to-day life of physicians and care teams, and what you see for continued change in the future.
So, Chris, my background happens to be in disaster medicine and emergency management. So in that field, our goal is always to come out of a disaster in a better state than what you went into a disaster, no matter how devastating. So the goal is always to bring us to a better new normal than what we had. And COVID is no different. Now, Kaiser Permanente started building its advanced care at home program. We started developing it in about 2018, really started getting serious in 2019, where we were building the program. At that point, we had patient focus groups, and there was conceptual acceptance of a virtual model. But I think that as we got into very detailed descriptions of how that might be, I think that there was some hesitation, not only on our patient focus groups and our patient side, but also on the staff and physician side. And so we recognized that that was going to be a barrier moving forward with our advanced care at home program. Now, that was pre-COVID. Well, then COVID hit, and of course, the world changed. And patients suddenly were afraid to go to the hospital. They got used to staying at home, and the world became virtual. People started seeing their primary care doctors virtually on, Zoom type platform. Even my 87-year-old mother is having virtual visits with her doctor now, and that is the new normal. And so what has happened to advanced care at home is that we have really benefited from that transition because of that comfort level that now exists that didn't exist before. And in addition to that, through this transition of COVID and everything moving virtual in the healthcare industry, the physicians and nursing staff and the healthcare teams now understand what the limitations of virtual healthcare is, and they know how to deliver care virtually, which is a skill set that we didn't have a few years ago. And then the last thing I'll say is that the same is true for patients, because patients didn't know how to Zoom with their doctor, or they didn't know how to log into a portal, or, in our advanced care at home program, it's easy. They don't have to log in anywhere. They just touch a button and they're there. But that comfortability of receiving care was not there a few years ago. So I think that in that way, COVID has really helped the transition of advanced care at home in a way that we wouldn't have seen had we not suffered through the pandemic.
Yeah, that's great insight. I think you're right. I think the receptivity of patients and the receptivity of providers, right, out of necessity, but then out of necessity seeing the utility of it has really been quite phenomenal. Margaret, I'm really interested in your thoughts on, how has this kind of changed the practice for physicians and for patients?
Yeah, well, I definitely agree with what Vivian was saying about how it was both patients and physicians. And I think a big thing that COVID did was really change a lot of people's mindsets from a fixed mindset to a growth mindset. For example, my 80-year-old mom, she was going to church on Zoom. Well, it didn't seem that big of a leap then to see your doctor on Zoom if you're going to church on Zoom. So what previously seemed unthinkable or impossible is now doable. And that has just unleashed creativity from the people that I work with and certainly opened minds of our patients. So, back to Vivian's comments about disasters, I think what we're seeing is some post-traumatic growth that, the future is exciting.
So we've talked a lot about what happened over the last, 3 years, and I'd like to finish up this wonderful podcast with thinking about the future. And I'd love to get your thoughts on the future of advanced care at home. Where would you like to see it go? Take out your crystal ball and take a look inside, and with all of your optimism and your expertise, are there specialties or patient populations you envision being reached as part of this next phase of care? Margaret, why don't we start with you on this question?
Yeah, I think, gosh, I am such an optimist about this, and it is really exciting to see as more healthcare systems are adopting this type of acute care. What are they coming up with, and how are they envisioning the future and meeting the needs of patients in their communities? Well, but one thing that I'm excited about is artificial intelligence. and using AI to create efficiencies for hospital at home programs. So I'm part of a team that helped develop an algorithm to more quickly assess patients to see if they're candidates. How can we quickly look at even the whole hospital census in just a few moments and understand who might be eligible to go home rather than taking a bed in the hospital where they don't want to be. So I'm excited about AI. I'm excited in general about devices and automation. I think about our patients in my rural community who are using hospital at home on the outside of the Eau Claire campus. How can we leverage automation so that we're not putting somebody in a car to drive 20 miles one way to bring a medication? And regarding specific patient populations, I'm particularly excited about cancer care. I think, for our loved ones who are battling cancer, a lot of them are just teetering on the edge, and every day at home matters. We're thinking a lot more about how we can support those patients on their cancer journeys.
Boy, hard to think of a more important population that's faced with something that's probably the scariest moment in their life, and then being able to get expert care, the best care on the globe in the comfort of their home. Vivian, I'd love your thoughts on kind of the future and where you see it going.
Well, Kaiser Permanente right now is live with this advanced care at home model in 4 regions. And so in the short term, my view of the future is to expand it to all of our regions across North America. So that's within Kaiser Permanente. But what I'd really like to see in advanced care at home is to see these programs become more and more robust. And so what I mean by that is the more comfortable we are with this, the more services that we can add, and therefore the higher acuity and a more variety of patients can be treated safely in their homes. So some things off the top of my head are, blood product transfusions or chemotherapy, which some programs are already doing. I also think that we will end up expanding our staff in our virtual hub. But in the far future, what I imagine is that advanced care at home will be able to provide almost all advanced care to patients, maybe short of intensive care, but really short of that, most of the patients will be able to be cared for in their home. And I think that that's a reality that we will see in the future.
I love both of your visions, and I think you hit on so many areas that this has applicability to, that create increased convenience and probably significantly higher adherence of patients. And I also love the idea of engaging families more directly, right? Families often visit a loved one, during a very, limited set of visitor hours, and their ability to see their mom or dad or brother or sister at home and to understand the care that's being provided really gets them more engaged in the care and helps their loved one heal. This has been such a fascinating topic, and I could think of a million more questions if we had all the time in the world, but I know you're both very busy, and I really appreciate you taking the time to talk with me and our listeners. You're both doing amazing work to lead the change and to lead the charge in this advanced care at home space, which will be a huge part of how people receive care now and into the future. Vivian and Margaret, I've enjoyed our conversation, and I'm so thankful for your intellect, your insight, your passion, and the difference that you're making.
Thank you so much, Chris.
It was a pleasure. Thank you.
And thank you once again to our listeners for tuning in. We hope you enjoyed this episode, and will take the time to subscribe or share a review. We'll see you next time. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.